At Meds Plus Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
Bringing the pharmacist back to the community, Meds Plus Consulting Pharmacy and Wellness Center. Hello, hello, hello. Today is Monday, January the 19th. And for all of our Meds Plus Medical Minute followers, happy Martin Luther King Jr. birthday today. So I know a lot of you may be at home or out in the community doing service work. We applaud you either way. Today's topic for Meds Plus Medical Minute is Metformin, the diabetes drug that does way more than you think. I decided to talk about this today because for every class of diabetes education, there's always a question, a topic, or something mentioned during the class that I usually have to kind of clear up. So we're going to have a talk about metformin today. Once again, this is Meds Plus Medical Minute, and I'm Dr. Jennifer, your diabetes care and education specialist, and we're going to talk about metformin. So metformin is one of those medications that is indicated for pre-diabetes. So let's talk numbers. There was a landmark trial or study that metformin reduced the risk of progressing from pre-diabetes to type 2 diabetes by 31%. And for patients that are 60 and older, with a BMI or body mass index of 35, that number jumps to nearly a 50% risk reduction. Now that's significant to note. Currently, 96 million American adults have prediabetes. That equates to about 1 in 3 adults, but only 20% of those that have it know it. Metformin is one of our first-line treatments for prediabetes. If there is a significant amount of weight that needs to be lost, then that may change to another drug of choice. Also wanted to let you know that metformin is more than just a diabetes drug, and it is also indicated for PCOS, and that stands for polycystic ovarian syndrome. Now, many of you listening may have been prescribed metformin for diabetes, but for polycystic ovary syndrome, you may be wondering, why am I taking this medication and I don't have diabetes? Well, here's why. PCOS affects 1 in 10 women of childbearing age, and it's associated with insulin resistance. This is the same problem we see in pre-diabetes. Black women are particularly affected, often experiencing more severe symptoms. Metformin addresses the root of the metabolic issues seen in PCOS. Studies have also shown that metformin can help regulate irregular menstrual cycles, improve ovulation and fertility, reduce excessive hair growth and acne, caused by elevated androgens, and help with weight management. And these are all common concerns with PCOS. Many of the patients with PCOS see improvement in their system within 3 to 6 months of consistent metformin use. So if your gynecologist or endocrinologist prescribe metformin for PCOS, it's evidence-based treatment for metabolic dysfunction underlying your symptoms. So it's not a mistake. So one of the things that I wanted to address, the elephant in the room, what I hear most often in the pharmacy is, Dr. Jennifer, I don't want to take this metformin because I hear it tears up your stomach. Now, I do want to acknowledge if you have experienced any GI symptoms, side effects with metformin, that was real, and I'm not dismissing your experience. But here's what you need to know. The most common side effect are gastrointestinal, which is nausea, diarrhea, stomach cramping, and they can occur in 20 to 30% of patients initially. For most people, these effects are temporary and typically resolve within 2 weeks as your body adjusts to the medication. If you have tried metformin and couldn't tolerate it, or if you're hesitant to start because of what you've heard, you do have options you may or may not know about. The immediate release formulation of metformin is the most commonly prescribed, and it can be harder on the stomach. But the extended release formulation releases the medication slowly throughout the day and is significantly more tolerated or better tolerated. There's also a liquid form, and the dosing strategy matters. When you're initially started, you will typically be started at 500 milligrams with your largest meal, and increasing slowly can also help cut the side effects in half compared to starting at full dose. So what does that look like? You get your new prescription, you start 500 milligrams at your largest meal, which is typically dinner, and you do that for a week. And then the next week, you would start to take it at dinner and after breakfast. So that way it gives your body to adjust to help tolerate, to minimize those GI side effects. So if you struggled before, talk to your pharmacist, talk to your doctor about trying a different formulation or a slower titration schedule. And if you're starting for the first time, ask specifically about extended release and titration dosing. Be cautious about the fear of the side effects that can be managed and keep you from a medication that could prevent or help manage your PCOS. There's also things that I hear sometimes in class about whether or not metformin causes weight gain. But here's what makes metformin unique. Most diabetes medications can cause weight gain as a side effect, which creates a frustrating cycle for patients trying to manage their condition. Metformin is not a sulfonylurea. Medications like sulfonylureas, and those would be your glipizide, glyburide, or glimepiride, can cause 5 to 10 pounds of weight gain. Insulin therapy often causes even more. Metformin is different. Clinical trials have shown metformin either keeps your weight stable or helps you lose an average of 4 to 6 pounds in about 6 months. It's the only pill you take by mouth for diabetes that is not a GLP-1, that won't cause you to gain, that won't make you gain weight. It'll actually help you to lose weight. And the game changer when you're trying to improve your health. And for my PCOS patients, this weight benefit can be especially meaningful since weight management is often a struggle with the condition. So we have 3 different formulations. Choosing the right one matters. Taking it at the right time of day matters most, because having food on the stomach when you take it helps to minimize those side effects. Typically, your largest meal of the day is in the evening. So once a day formulation in the evening is optimal dosing. One thing I would like to add is to make sure you're monitoring your B12 annually. 10 to 30% of long-term metformin users develop a deficiency. So want to make sure that you're checking your B12 levels or supplementing with a high-quality vitamin B12. So what should you do? If you have an A1C, between 5.7 and 6.4. And you know, we talk about knowing your ABCs. A stands for A1C. Or if you have a fasting glucose of 100 to 125 and risk factors for diabetes based upon your age, 35 and older, if you're overweight, have a sedentary lifestyle, come see us at Meds Plus and we can help you have the right conversation with your provider and help you monitor your success. So remember these pearls about metformin. If you have questions, reach out to your doctor or pharmacist, us here at Meds Plus. Just reminding you that prevention is prescription and metformin is proven prevention. Remember, Meds Plus is here to help you with your prescription needs, your pharmacy delivery needs, or your chronic condition management. We can be reached at 205-650-4636. Thank you so much for tuning in today for Meds Plus Medical Minute. And if you know of someone that needs to hear of this, share it with them. I'm sure they will be so glad that you did. That does it for this week's Medical Minute. And in Dr. Pauline's absence, we would like to wish you a happy MLK Day, and we will see you next week. Have a magnificent day.
At Meds Plus Consulting Pharmacy and Wellness Center, results matter. Empower your health journey with a pharmacy that puts you first. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. Meds Plus Consulting Pharmacy and Wellness Center.